Dr. NAMITHA SURESH KUMAR.
Morning all. My topic is correlation of disk damage likelihood score with average RNFL thickness determined by OCT and visual field globulin disease in established cases of primary open-angle glaucoma.
Time start. Time.
Introduction. Glaucoma manifests clinically as a loss of optic disc neuronal rim tissue, RNFL defects and visual field defects. Traditionally, vertical CD ratio is used to evaluate the optic nerve changes. The CD ratio does not take into consideration the diameter of optic disc or focal changes in neuroretinal rim. The disc damage likelihood scale is a system that incorporates disc size and rim disc ratio in the clinical grading of disc. It is useful in diagnosis as well as for assessing the severity of glaucoma, and as a standalone test, RNFL analysis has great diagnostic ability to detect early pre-perimetric glaucoma, and in perimetric diseases, RNFL loss with a corresponding visual field change is helpful in confirming glaucoma. A mean deviation and pattern standard deviation of global indices, which gives a numerical quantification of visual field loss in decibel. The aim of our study was to determine the correlation between DDLS with average RNFL thickness in OCT and visual field global indices, that is mean deviation, pattern standard deviation, established cases of primary open-angle glaucoma. Study design was a cross-section study. Study period from January 2021 to June 2022. Study populations, patients attending the OPD and diagnosed as having primary open-angle glaucoma. Sample size was 60. Inclusion criteria: all diagnostic cases of primary open-angle glaucoma with best corrected vision more than 660 in versi, an age in between 40 to 80 years, and reliable automated perimetry. Exclusion criteria: other ocular diseases associated with raised IOP, cloudy media impairing fundus examination, and history of intraocular surgeries within last 3 months. Study procedure: patients with POG satisfying inclusion-exclusion criteria were enrolled into the study after getting an informed consent. Brief biodata and history were taken, and all subjects underwent complete ophthalmological assessment, including visual acuity, refraction, slit lamp examination, IOP measurement, Goldman applanation tonometry, and gonioscopy. Visual field charting using HFA CETA standard 24-2 program. An average RNFL thickness assessment with calcium spectral domain OCT. The fundus was examined using an 90D walk lens and slit lamp, and DDLS score was calculated. Result: the mean age group was 60.2 with a standard deviation of 9.38. Among the subjects, 33% were males and 6.7% were females. Average RNFL thickness was 73.48 with a standard deviation of 14.91. Average DDLS score was 5.33 with a standard deviation of 1.26. Average visual field index was 82.8 with a standard deviation of this is a scatter plot diagram with DDLS score along the x-axis and average RNFL thickness along the y-axis. As the DDLS score increases, average RNFL thickness decreases. The Karl-Pearson correlation coefficient between the two parameters were minus 0.630 with a p-value of less than 0.01, which corresponds to a highly negative correlation between the parameters. This is a scatter plot diagram with DDLS score along the x-axis and mean deviation along the y-axis. As the DDLS score increases, mean deviation decreases. The correlation coefficient was minus 0.662 with a p-value of less than 0.01, denoting a highly negative correlation between parameters. This is a scatter plot diagram with DDLS score along x-axis and PST along y-axis. As the DDLS score increases, PST also increases. The correlation coefficient was 0.564 with a p-value less than 0.01, corresponding to a moderately positive correlation. Correlation of average RNFL thickness with mean deviation, the coefficient was 0.617 with a p-value of less than 0.01, corresponding to a highly positive correlation. And correlation of average RNFL thickness with PST, the correlation coefficient was minus 0.447 with a p-value of less than 0.01, corresponding to a moderately negative correlation. Discussion from the study: we found a strong negative correlation of DDLS with average RNFL thickness and mean deviation, and a moderate positive correlation with PST. And the average RNFL thickness is showing high positive correlation with mean deviation and moderate negative correlation with PST. Comparative study of two methods of optic disc evaluation in patients with glaucoma by Chandra et al. Demonstrated that DDL showed a strong positive correlation with mean deviation and a strong negative correlation with RNFL thickness, and a weak positive correlation with PST. In a study with Narayana et al., Comparing vertical cup disc ratio with DDLS score with visual field indices, DDLS showed a strong correlation with mean deviation and PST. Conclusion, we found a strong negative correlation of DDLS with average RNFL thickness and mean deviation and a moderate positive correlation with PST. Average RNFL thickness is showing high negative correlation with mean deviation and a moderate negative correlation with PST. Thus, DDLS score is a good indicator of optic nerve head status and has good correlation with average RNFL thickness and visual field index in POAG. Limitations of the study, DDLS used in the study is a clinical scale and it is subjective and can vary with observer, and it does not document progression in more than one region in cases of multiple areas of focal thinning. These are my references. Thank you.
So you have not shown any OCT picture compared with the NDLs and all. See, only when you show some picture which has got some DDLS, the changes in your corresponding OCT picture, so that you can assess. When you have not shown that, just reading may not be useful, no? You should have taken some photographs. That is my opinion, okay?
So what do you think is the advantage of DDLS score compared to CD ratio?
Ma'am, DDLS is a clinical score and it incorporates the disc size as well as the focal narrowing of rim disc when compared to the CD ratio.
So what is the limitation when you are comparing the focal notch alone and the rim tissue? What is the limitation?
When there is multiple focal narrowing, DDLS is not useful.